A dislocated shoulder means that the ball has come out of the socket. And so I like to show my patients using my hands. This is the ball of the shoulder and this is the socket. Usually there's some type of trauma that a person will have playing a sport, putting themselves in a provocative position, and the ball comes out ever so slightly. When that happens, the tissues, soft tissues, ligaments around the ball get torn. So when the ball goes back in, those soft tissues are still damaged. And so what we do when someone says they feel like they've dislocated their shoulder is first do a physical exam to make sure that the shoulder is back in place. And then second, do some imaging, such as an X-ray, and if you can get to it fast enough, an MRI scan. Sometimes when the dislocation's been around for a while, I get a special type of scan called an MRI arthrogram. And then depending on what the damage is, according to the scan, we may or may not have to do surgery. Usually, if the person is over the age of 25 or 30 and not very active and doesn't do lots of sports and just suffered the injury from a fall, I might treat that person conservatively with rehabilitation and see how the patient does. And then if the patient unfortunately dislocates a second time, then I'd be more inclined to recommend surgery. In the young, active patient, especially someone who's under the age of 20 who's dislocated the shoulder, I'm much more likely to recommend surgery. And the reason is the studies show that long-term, those patients don't do as well if they're not operated on. I use the analogy of an ACL tear. When someone young tears their ACL and the knee is unstable, they have surgery. And so it's very similar in the shoulder. One final point, some patients are more loose-jointed naturally than others. Those patients that are more loose-jointed are more likely to get their shoulders dislocating than those who are not. And so sometimes those patients don't need surgery because it's natural for them to have an unstable shoulder. So the most important thing is to find out what the proper diagnosis is and see whether or not you can avoid surgery.